Then moving on to gender, which is more the how I define myself inside. This is quite a useful summation slide in a way, because it reminds us that we have that sex that is assigned at birth, that we have a gender identity, which is a strong inside feeling of being a man or male, a woman or female, or I might feel both male and female, or neither male nor female, or sometimes male and sometimes female, or some other term altogether, which I have devised for myself, like agender or gender queer. Then gender expression, the bottom left, goes to how I might express my gender in the world. And this is an important aspect of this whole story, because for people who are transgender or gender diverse, this is an opportunity for them to show the world and, in a sense, to tell their own story of how they feel about themselves inside as a gendered person. So the kinds of cues that we might use here would be with how we act or walk or talk in the world, how we speak, how we interact with others, what interests we develop, the kinds of clothes we might wear, the mannerisms we might adopt, or the extent to which we conform to socially prescribed roles, which on the bottom right tells you a bit about patterns of and expectations that society dictates about how we should conduct ourselves. And all of this, going to the block in the middle, again, come back to the idea of social construction, that ideas about gender have changed over time. That the way that we express ourselves as gendered beings today might be different from our parents, or from our parents' parents, or from our parents' parents' parents. And ideas about what is appropriate for male bodies and female bodies to do in the world have shifted over time and shaped by history, by social circumstances, by economies, by laws, by policies, and by the politics of the day. Many of us, well, maybe not many of us, but some of us might be old enough to remember ideas around the suffragettes who fought for the rights of women to vote. So even the fact that women could not adopt a certain particular political role in society has been shaped by history, showing us that these ideas have shifted over time. And gender is not a binary, it is a spectrum, which is an idea we will be coming back to a lot today. So gender identity, in a bit of a deeper dive, is a person's deeply felt internal sense of who they are. For example, as a man, woman, both, neither, or on a spectrum. It's about how people experience and understand themselves. So it is very much a strong inner, often well-developed over time for many transgender diverse people from childhood, but not necessarily only from childhood. But usually for a very long time, this person has felt this understanding of themselves. So it's not about how the world sees them, it's about how they see themselves. And it's a combination of factors which helps an individual arrive at that gender identity. And for those of us in the room who are cisgender, that is, we identify with the sex that we're assigned at birth. Often we may not be able to articulate very clearly, when is it that moment when I knew I was or I felt like a man or a woman? And we can't necessarily pinpoint a time or a day, but we would know that it is just something we came to as an understanding. And it may be a consequence of many factors. Later on, we will refer briefly to the fact that there is a biological element to this, but it's many influences that shape how that identity evolves over time. And often it may not align with the sex a person was assigned at birth. I think I'd like to echo what Madeleine said a bit earlier. We come to this conversation in recognition of respect for people's diversity and self-identification, for their dignity, for their self-worth, and that we are on that journey with them, rather than, in a sense, trying to second guess, is this person really trans or gender diverse or not? So the core idea about gender being self-identified the person knows themselves. And to be able to express it authentically is central to their well-being and their sense of dignity. It's a very strong and powerful force in a person's life. Briefly, just an idea of how the world likes the binary. We've got to choose that toilet. Many different signs that tell us about that. And a flag which captures some of the complexity of what I've been talking about today. Don't worry about the flag. We're not going to be testing you on it. So what is trans or transgender? So I think by now it's clear that it is a broad term, a spectrum term for people who experience and express their gender in non-traditional ways. And the opposite, although we'll come to the idea that is not necessarily a neat opposite, or in relation to people who do identify with the sex that was assigned at birth. So we would use there the term cisgender and or cis. So for trans people, transgender people, these are people whose gender identities and expressions are not typically expected for the sex they were assigned. We don't use the term transgenders, and this person is transgendered, but we tend to say a trans person or trans people. We might say they identify as trans or transgender. Please, we're going to get it wrong sometimes. We extend grace to each other in this session. Our clients extend grace to us. Working in this field, we make mistakes sometimes. We note it. We sometimes apologize if it's right, and we move on. Our intentions are genuine. Let's watch a brief video together.
Hi, I am 7 years old. Mama didn't know that I was little and I didn't like that, and I wanted.
Here, I'm not sure that's going to work.
Me a boy.
Is it not coming through?
It's very jagged from my side. I don't know if you can hear it clear on your side.
It's perfect on my side.
Oh dear.
Maybe we should just let it go then. Madeleine?
Okay, yeah, and we will send the little videos around. I'll get the links and things. Somebody was just asking about the resources. We will create a Dropbox folder or a Google folder, probably at the end of both sessions, which we'll share with everybody, and that will have the slides available and various resources that you can use.
So sorry about that, but since I'm mindful I've got 15 minutes left, perhaps it's not the worst disaster in the world that we have to skip the video. But it is a very heartfelt story of a young child talking about their sense of their gender identity. Being trans or gender diverse is not that common. These are some estimates in adult and children and adolescent populations. If we expand the definition slightly to include broader manifestations of gender diversity, we see perhaps a maximum of 4.5% among adults and up to 8% amongst children. But I think it's important to note in the time of panic about trans and gender diverse people that it is a small segment of our community that feels that they are trans or gender diverse. Is cisgender versus transgender a binary in the sense that there's nothing in the middle? And we would say no, because the existence of non-binary people tells us something about this is a spectrum. There are many people, in fact, who fall in between cisgender or transgender. And again, it goes to the idea of not necessarily just a third middle grouping, but a broad spectrum along which many people can identify in different ways. One way that we try to police people's sex and or gender is through bathroom access. And there's a lot of surveillance that happens in this space because the notion of bathrooms as being binaried implies that there's an either or operating, and only certain bodies can use certain bathrooms. And there are already examples today, as trans hate has increased in parts of the world, that people who do not fit the norm, in inverted commas, of how a woman should look, how a man should look, are being policed about their bodies, and raising, I think, this question about, well, this policing is an attempt to remind us there should be a binary, but it is a reminder, perhaps, that there isn't a binary, and we could possibly find more creative ways to manage people's ordinary bathroom needs. I'm going to skip this video because the video isn't working, but to talk about non-binary as an umbrella term, and here is some languaging that we could think about. People who are androgynous, neither particularly masculine or feminine. Someone who's gender fluid may embrace, find their gender expression or being is evolving or shift, and may be context dependent. Someone who's agender may not identify as a particular gender. Someone who's gender queer doesn't have a fixed sense of their gender, but maybe just feel that it is different, and not fitting into a neat binary. And gender non-conforming folk might have ways of being in the world that don't correspond to the traditional expectations of their gender. So how do I know a person's gender identity? Primarily, I guess by asking them, allowing this person to tell us how they see themselves and what preferred pronouns they might use. We distinguish here between the name that might be on the say, the birth certificate or identity document. Sometimes it's called the dead name, the name by which the person no longer wishes to be named. We might talk about a real name. Some people might use that to mean the original legal name, or a name that has been given to them. But ultimately, a respectful way of operating in the world is to use the person's preferred name. For those of you who might be in positions to see clients in say, private practice contexts, intake forms and such can make space for that. So language really matters in working with our trans and gender diverse clients. We aspire for fluency, and to show our respect in terms of how we communicate with our clients. But because this is evolving constantly, and is multifaceted, it can be quite difficult to stay abreast of trends. And nobody, honestly, I can say the expectation of us towards yourselves is not that you necessarily are up to date with every new iteration of an identity term. But I think a basic working knowledge is important, if one is going to be working in this field. And certainly, while clients may be willing to, and often are willing to, educate and guide us, it can be hard work sometimes to be in that role of constantly reminding the person you're seeing how you wish to be addressed, especially if you have already told them that before. But we accept again that people are human and we make mistakes. There's a suggestion of a biological basis to trans identities. Growing number of studies which suggest a biological underpinning to this. I think this is interesting in terms of what it could mean for activism, because when society believes that people choose, quote unquote, to be trans, there's a sense in which it is seen as a deliberate defying of convention and mores and norms, whereas the sense of being born this way allows for a different kind of activism. I believe either is legitimate, but I think the fact that there is a possible biological basis should guide us in terms of our compassion and the kinds of approaches that we develop, and the legal and human rights framework that should guide us. In terms of transitioning, what we know is that there are a number of dimensions to this. So transitioning is, the term is self-evident in some ways, is that moving from one thing to another. A social transition would be those aspects of change that you can make just by yourself without anybody else's intervention. So you can change your name, the pronouns that you're comfortable with, how you dress, what roles you adopt. And if you have the support of your family, your community, your workplace, and a school, then your transition is enabled. And we have an absolute right to do this in South Africa because of our equality and dignity clauses in our constitution, which indicate that every person has innate worth and dignity and is entitled to be who they are. And gender is a protected term in terms of the equality clause of our constitution. One can legally transition, where you can formally and legally change your gender marker and or your name on your official documents. This has certain barriers attached to it. Sometimes different Home Affairs departments are more or less sympathetic. This can have certain implications for legal documents, but they're not insurmountable. But often this is an important aspect for a trans person to find that they're then able to find a match between their gender identity and their legal status. A medical transitioning, which you'll hear a lot more about over the next, particularly the session after this one, would refer to hormones, possible surgeries, perhaps voice therapies, all of which are ways to align one's body with that inner sense of gender identity. Access is very complex in South Africa. It's for people who don't have resources. The public resources are very, 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 very oversubscribed, and for many people, it can be almost decades to get that kind of care. But there are slowly shifts that are happening, as Dr. Muller will share more with you, in terms of availability of hormones in the public healthcare system in South Africa. And this form of transitioning is very well described in ethical frameworks. There are important guidelines, the WPATH standards of care, and the HPCSA guidelines, which offer an affirming or patient-centered approach. And then psychological transitioning really is about that inner work that someone like me, but certainly anybody in this room could do to help the person develop self-acceptance, deal with the stigma that's coming to them from the world or that is inside them that has been internalized, and building the supportive networks that they might need to affirm them and help them live lives of satisfaction. We know there's excellent research that shows that affirming care improves well-being and reduces risk of depression and suicidality. So what is an affirming stance? It's validating the client's own understanding of themselves. So the starting point is a trust in the person's lived experience. We're not second guessing our clients or patients. It's respecting how they present themselves and the way that they choose the names and pronouns and gender identity consistently. We're offering informed support so that our clients can make their choices in an informed way. So again, there's an aspect there of becoming informed. We're seeing our clients in their whole selves, not just as a medical intervention, but as in need of mental health and family and community support, and access to a range of services. We work collaboratively with our clients. We do not have a pathologizing approach, but we see gender diversity as a natural variation of humanness, not as a disorder to be treated or fixed. We also need to recognize that in South Africa, many of our clients and patients experience violence, not only physical violence, but you could argue structural violence in terms of how they may have limited access to the kinds of services and policies and systems and hormones that they need to live lives of dignity. So an affirming stance is not neutral in the sense that it is a kind of wait and see, because we believe that can reinforce harm, because it sends a message to the client that we don't validate their identity and who they are. And sometimes wait and see can be weaponized in the hope that the person will not be trans going forward. And there's very little evidence to support that idea. It's not about questioning or testing the person's identity, and it doesn't assume that all trans and gender diverse people want or need a medical transition. So in summary, trans people in South Africa come from many backgrounds, across all communities, and there's no one story of being trans in South Africa. And people come to us with a variety of self-expressions and labeling and terminologies and life stories and experiences. For some of our clients, they will come with strong sense of how their culture informs their understanding of their gender identity or their gender diversity. We know of healers who feel that they are understand that they are channeling or working with an ancestor of a different sex or gender, and that is who comes through them, and that is a person's understanding of their gender diversity. Our job again is to respect and validate that journey of our clients. So there's no one way to be trans or gender diverse, no one way to transition. And for some people, those more complex aspects of transitioning may not be for them. They may be comfortable to start and stop transitioning or transition and maybe re-transition in a different way. And again, a supportive journey is the most helpful way to work with a particular client. So the core ideas of self-determination, dignity, and access to support of all kinds is a key aspect of our work. Thank you very much, Madeleine. I think I just on time.
Well done. Very impressed. Thank you very much.
Okay.
Yeah, if you